As reopening continues, we're keeping an eye on coronavirus cases around the globe. And tonight, our national investigative team has some new surprising numbers from South America and testing here in the country. Here's Investigate TV's Lee Zurich with our COVID-19 tracker.
It's fall in South America, and the coronavirus curve in some countries is taking a sharp turn up.
Brazil, Peru, Chile look devastating right now. The rate of growth in new cases is huge. It is becoming the next massive epicenter.
Brazil will likely surpass Russia with the second most confirmed cases of COVID-19 in the world.
And remember, we have a blocked travel with Europe. We have blocked travel with much of Asia. We have nothing blocked with South America, and yet they have the highest case growth in the world.
In the United States, new cases are falling in many parts of the country, but we're still seeing pockets of hotspots like Amarillo, Texas, Salisbury, Maryland, and Montgomery, Alabama.
There are quite large explosions of cases in both very urban areas as well as much more suburban areas, and we're going to be like that for a long time now.
On a per capita basis, Fargo, North Dakota has seen the second highest number of positive cases in the past week. According to our COVID-19 tracker, per capita, the state of North Dakota has tested more residents than all but one state, Rhode Island. But according to state officials, 35% of the state's positive cases were asymptomatic.
We realize a lot of this, as far as trying to get ahead of it, is some of that sentinel testing, because there's so many people out there that they have no idea that they are actively shedding that virus.
And does that make fighting this harder, because there are so many asymptomatic people and they could be spreading it and not even knowing that they're spreading it?
Yes, sir. And so you have to have that part of your testing strategy. You have to have some, so as we call it, sentinel testing in there, and encourage folks that are, especially in a high exposure rate as healthcare providers or law enforcement, that are going to have exposure just because of their line of work. Even those that are in our service industry, in our grocery stores that keep our food supply going.
Yale Dr. Howard Foreman cautions many asymptomatic carriers end up eventually having some symptoms.
A lot of people will spread virus at a considerable rate before they even have the first symptom. Now, a lot of people are going to have very mild symptoms from this, so I'm not taking that away. But even people that have mild symptoms will have 2 or 3 days of pre-symptomatic spread where they are completely oblivious to being infected, and yet they could individually infect 100 people if they're put in the wrong circumstance.
And as of this afternoon, North Dakota ranks second, Minnesota 34th in the country for testing per population. That's according to data collected by the COVID Tracking Project. Up next on Valley News Live 10 at 10, with everyone stuck inside, a popular piece of workout equipment has dropped in price.